Good morning. I feel extremely delighted and also privileged for the opportunity to share with us a few thoughts about emotional and mental well being this morning. I am particularly grateful to Il and to Titilola for the warm invitation that you extended to me. And it is important, particularly because today is the third day of our Mental Health Awareness Week in the UK. And the Mental Health Foundation have aptly titled this year's theme on anxiety. Given all that has happened following the pandemic, following the lockdown, it is apt to discuss anxiety this year. We do know, for instance, that following the lockdown, the levels of anxiety in the community has escalated, and up till now, the levels have not returned to pre-COVID days. So anxiety is something that it is okay to talk about currently. Now, what is anxiety? Anxiety is a common human emotion. It's something that we all feel at some point in our lives, and it's part of our body's way of rising up to the challenges of modern day living. Sometimes, when we are preparing for a big day, a big event, or even for a speaking engagement, like I had some anxiety about preparing for today's presentation, for instance. However, that has not been a crippling form of anxiety. Anxiety becomes a disorder when it is frequent, when it interferes with our day to day functioning, when it leads to an avoidant behavior in which we avoid any situations that causes the anxiety, and when it prevents us from bringing our best selves to our work, to our family, to our ministries, and to everyday living. That at that point is then called an anxiety disorder. And it's not all doom and gloom. In fact, there is a message of hope, and I'm hoping that this is the take home message for everyone listening to me today. Many times during my psychiatric consultations, I usually end with this phrase. I will say, I know that at this time you are struggling with generating your own hope. However, my expectation is that today I aim to loan you some of my own hope. This is in anticipation that over time you can develop your own hope, and as you develop yours, you can then loan back mine to me and possibly with interest. The interest will be paying the same hope forward to anyone who is experiencing distress and at a point in their lives when they are struggling to be hopeful. So, what do we know about anxiety and what is there to be hopeful about? The first reason to be hopeful is that anxiety is a common life experience. Research shows us that about 1 in 6 adults in the UK suffer from some sort of anxiety disorder. We also do know that in a lifetime, about 1 in 3 people will experience anxiety at some point. Anxiety disorders are hence very common. The reason why a lot of people do not seek help is because of the stigma and shame associated with the condition. Research shows as well that numerous people do not get help, and it's because they keep their anxiety disorders a secret. The other good thing about anxiety is that there are proven interventions over and over again that have shown that anxiety is a treatable condition. And in fact, anxiety can be treated without medication sometimes. And there are several things that anyone who is experiencing anxiety, who is experiencing stress, can do for themselves to make their conditions better. And the final thing I want to share in terms of being hopeful today is that actually anxiety disorders are treatable conditions and that recovery is not only plausible, but it is something that is commonly experienced. With that in mind, what then can be done if you want to recover? What are the things that one can do to help? What are the self help things that you can practice for yourself? The first thing is to collect as much information and get to know the condition as much as possible. For starters, I've shared that is a common condition. But in addition to that, we also do know that in a recent Mental Health Foundation survey carried out in March 2023, that three quarters, about 73% of adults in the UK, actually admitted that in the past 2 weeks they have experienced anxiety at some point in that period. In addition, 1 out of 5 of us actually said that not only have they experienced anxiety, but the anxiety has been at most times, or in fact, all of the times during the last 2 weeks. We do know, for instance, that females more than males were affected, and that other at-risk groups are single parents, 18 to 34-year-olds, people from Black and ethnic minority backgrounds, and also people who suffer or are living with a chronic physical health condition, or carers of those who have those conditions. What else can we do in addition to collating knowledge and information about anxiety disorders? The other thing we can do is to connect with our breathing. And right now, I'm going to share a life skill that all of us can use in dealing with anxiety. It's a common breathing technique that I use frequently during my psychiatric consultations. I call it the 4-7-8 rhythm. It's very easy to remember, 4-7-8. And what does that mean? It means we close our mouth, breathe through our nose, inhale through our nose for 4 seconds as we count down to 4. That's 0, 0, 1, 2, 3, 4. We then hold the breath for 7 seconds. And after 7 seconds, we breathe out through our mouth like we are breathing out into a balloon. And the exhaling, the breath, breathing out takes 8 seconds. So it's closing your mouth, breathing in through your nose for 4 seconds, holding your breath for 7 seconds, and then breathing out for 8 seconds. And if one repeats that cycle 3 times, you have 4 cycles of that short breathing exercise. It lasts just a little over a minute, if that. But the good thing is that this actually triggers mechanisms in our body that calms the body down. The other thing that is commonly used in dealing with anxiety is something that is called progressive muscle relaxation. A good place to go to for that is on the Every Mind Matters www.nhs.uk/Every Mind Matters. That's a good place to listen to a recitation of how to engage in breathing in progressive muscle relaxation. What else can we do? We can also connect with our bodies. Connecting with our bodies, in this case, I mean exercise. Exercise has been proven over and over again to be of benefit, not only to relieve stress, but also to relieve anxiety. And the good thing is that exercise does not have to be a chore. If you enjoy swimming, then go for swimming. If you enjoy running, then go for a jog. For some, it's aerobics, for some, it's dancing. But the important thing is to fashion your exercise after your own lifestyle. It does not have to be a chore. It's got to be something that you enjoy. The final point I want to make today is that we need to connect with others. Connecting with others could be connecting with others in church, connecting with others through volunteering, through a work group, through social clubs, whatever it is that makes you connect with others. That is a good thing, because as we talk about anxiety and share with confidence, that can actually also bring us relief. The final point I want to make this morning is this, and this is the key point, that it is okay to get help. It is okay to ask for help. Many times we have restrictions and we feel inhibition about asking for help. The GP will be the first port of call when one wants to ask for help. There are also other online resources such as the www.rcppsych.ac.uk, that's the Royal College of Psychiatrists website. There's also the Every Mind Matters website that I spoke about earlier, and there's the www.llttf.com, which is the livinglifetothefull.com website. I do hope that listening to me has given you some hope this morning, and I anticipate that in the future you can loan back the hope to me, or better still, pay it forward to others, such that somebody who is less hopeful at that point can gather hope and generate hope as a result of listening to you too. Thank you for listening. Thank you.